Hello everyone, have you recently noticed that your weight is dropping without any specific diet? If you're thinking, wow, I'm losing weight, that's great. Hold on, please watch this video until the end, because what I'm about to share could save your life. In fact, a woman in her 30s in the US lost 10 kilograms over 6 months without any apparent reason, and received compliments for her successful diet. However, after undergoing medical tests, she was diagnosed with pancreatic cancer, but only after the disease had progressed significantly. Right now, there may be people experiencing unexplained weight loss. In this video, I will explain when weight loss becomes a warning sign and what diseases might be lurking behind it. First, we need to distinguish between normal and abnormal weight loss. Normal weight loss can occur due to starting an exercise routine, changing your diet, or temporary changes due to stress. However, medically concerning weight loss has specific characteristics. If you lose more than 5% of your usual weight within 6 months, meaning for someone weighing 60 kilograms, that's more than 3 kilograms without a specific reason, it's a cause for concern. You might think, isn't losing 3 kilograms no big deal? But it absolutely is. Medical research shows that about half of patients experiencing unexplained weight loss are found to have serious underlying conditions, such as cancer, chronic infections, or endocrine disorders. This means that 1 in 2 people may have a serious illness hidden beneath the surface. So what diseases can cause weight loss? First, the most suspicious disease is cancer, particularly pancreatic, stomach, lung, and colorectal cancers. Often present with weight loss as one of the first symptoms without any other noticeable signs. Cancer cells consume a significant amount of energy from our bodies while secreting substances that reduce appetite. In fact, a study found that many patients who visited the hospital due to unexplained weight loss were diagnosed with gastrointestinal cancers. Second, diabetes. You might think, isn't diabetes a disease that causes weight gain? In diabetes, especially when insulin resistance increases or insulin secretion decreases, the body cannot properly use glucose in the blood for energy. Instead, it breaks down stored muscle and fat for energy, leading to rapid weight loss. If you experience excessive thirst and frequent urination along with weight loss, you should suspect diabetes. Third, hyperthyroidism. When thyroid hormones are overproduced, metabolism speeds up abnormally. It's like pressing the accelerator of a car all the way down, causing the body to burn energy excessively. In such cases, weight loss is accompanied by symptoms like a rapid heartbeat, trembling hands, and difficulty sleeping. Fourth, many people are unaware that depression can also cause weight loss. Depression is not just a mental illness. It can actually alter neurotransmitters in the brain, affecting the appetite center. Severe depression can lead to a loss of taste for food, or a complete loss of appetite, resulting in significant weight loss. Fifth, infectious diseases. Conditions like tuberculosis, HIV, and chronic infections can lead to persistent weight loss due to inflammation and increased metabolism. Tuberculosis, in particular, is a classic disease that causes weight loss by consuming excessive energy. It's crucial to check if these symptoms accompany weight loss. If you experience persistent fatigue, loss of appetite, abdominal pain, digestive issues, coughing, or fever, along with weight loss, you must get tested at a hospital. This is especially important for those over 50, those with a history of smoking, or those with a family history of such diseases. But here's a critical fact many people think, thank goodness, I'm losing weight, and delay visiting the hospital. This often leads to missing the golden opportunity for early detection. Let me share another real-life case. A man in his 40s lost 8 kilograms over 3 months, but thought, great, my middle-aged belly is shrinking. However, after his wife urged him to get checked, he was diagnosed with stage 2 lung cancer. Fortunately, it was detected early enough for surgery. But if he had waited longer, so when should you go to the hospital? First, if you lose more than 5% of your weight within 3 months, go to the hospital immediately. Second, if weight loss is accompanied by other symptoms, you should hurry to get checked. Third, if you are over 50 or have a family history of cancer, even minor weight loss warrants a checkup. What tests will you undergo at the hospital? Initially, blood tests will check for anemia or inflammation. Levels and urine tests will assess for diabetes or kidney function. Thyroid function tests will check for hormonal imbalances, and liver function tests will look for potential liver diseases. Next, imaging tests will be conducted. A chest X-ray will check lung health, and an abdominal ultrasound will examine the organs in the abdomen. If necessary, CT or MRI scans may provide more detailed images. Sometimes, endoscopic examinations may be needed to directly check the stomach, or colon or tissue biopsies may be required. You might think, that's a lot of tests and they seem complicated. But these tests can lead to early detection of diseases that could save your life. Finally, prevention is key. Regular health checkups are essential, and it's important to develop a habit of closely monitoring your weight changes. This doesn't mean weighing yourself every day, but rather being sensitive to changes like if your clothes feel looser or if your belt holes change. Maintaining a healthy lifestyle is also crucial. Regular meals, appropriate exercise, quitting smoking, and moderating alcohol consumption can prevent many diseases. Remember, unexplained weight loss is not a welcome gift. It could be a significant warning signal from your body. Don't dismiss it as nothing serious. If you have any doubts, don't hesitate to visit a hospital. Early detection is the key to treatment and could save your life. If you found this video helpful, please like and subscribe, and share it with anyone who might be struggling with similar symptoms. Wishing you a healthy day, and see you in the next video.